everyone, it's Dr. Bryant here, and I want to tell you about what you need to know about your child's ear infections. Pulling on the ears, frantically crying, screaming at the top of their lungs, sweating with a fever, and wondering, what's going on with my child? Well, could it be an ear infection? Ear infections are very common. So common that they affect up to 3/4 of the children in the U.S. by the age of 3. But sadly, this is commonly the condition which starts children down the antibiotic train, of which it seems like there's no return from. Have you ever wondered if antibiotics or medical intervention was the only option when it comes to childhood ear infections? Well, they're not necessarily. But before we go down that rabbit hole, we should ask ourselves, is your ear infection actually due to infected ears? Did you know that a child's eustachian tubes or ear canals are not angled downwards like those of adults? Nope. Actually, a child's canals are horizontal, which prevents the babies from getting that much needed assist from gravity to move the fluid from the lymph nodes in the ears into the throat and out the body. Now, problems arise with the fluid and congestion buildup in the lymph nodes on the side of the neck and throat, preventing the fluid to be moved or flushed out of the child's body. So you might be asking yourself then, where does the fluid go? It has to go somewhere. And generally it gets backed up in the child's eustachian tubes, causing fluid pressure on the back of the eardrum. This pressure ultimately leads to swelling and irritation, also known as pain, just like an infection, and if it goes unaddressed long enough, it can progress into an infection. Just remember that in order to truly diagnose an infection in your child's ear is by doing a swab of that area and culturing it. Just because your child is in pain, acting funny, or pulling at their ear or eardrum, and it may be a little red, doesn't mean that your child has an infection. Well, what else could it be? Could it be teething? Well, did you know that teething more often than not can mirror the symptoms of an ear infection? Remember, we are a sum of all of our parts. The ears, the nose, mouth, throat, and neck, it's all connected. So think about it this way. If your gums begin to swell, then they can become inflamed, which leads to swelling of the upper neck and ears. As a result, this can give an appearance that the ears look pink or red and may cause pain in these instances. Most likely your child does not have an infection though. Unfortunately, since the ears look pink or red and babies are uncomfortable in tugging at their ears, it's often treated like it is an infection. Luckily, once the swelling decreases, the fluid usually disappears as well. But it can take up to 2 years for your child's baby teeth to come in, with the molars coming in last. Molars are the teeth closest to the ear, so it's easy to confuse those symptoms. So you may be asking yourself, so if it is an ear infection, what should I do? Can chiropractic care help? So bear with me for a moment as I'm about to get a little bit technical. The cause and prevention of ear infections lies within the anatomy. There's a small muscle called the tensor villi palatini, which is responsible for opening the eustachian tube. It is controlled by a branch of the trigeminal nerve, which has tracts that extend all the way down to the brainstem and arches at the top bone of the neck called the atlas. See, the atlas can misalign after traumatic events like childbirth or slip and falls during development, which can put pressure on the body of this nerve and cause dysfunction of the tensor villi palatini. If this muscle isn't working properly due to a misalignment of the atlas, the eustachian tubes won't open to allow for proper drainage, which in turn can lead to fluid buildup and possibly to an ear infection. Correcting misalignments to the atlas in a young child or even an adult will unwind this cycle by taking pressure off this nerve, restoring function to the tensor villi palatini, allowing the eustachian tube to open and drain efficiently and resolving the ear infection at its source. Well, is there anything else that can be done? Well, for pain relief, if your baby is exhibiting signs or symptoms of a possible infection, or if they're not necessarily infected but are having a lot of ear pain, there are things you can do such as garlic emollient drops. Garlic emollient drops can be used to help with inflammation and pain in the ear. Warning, it does smell garlicky, but it really does help to reduce the pain and swelling. There's also colloidal silver. It's a natural antibiotic, antiseptic, and antifungal. Putting colloidal silver in the ear can help kill any bacteria congregating in the ear canal, which can also reduce the swelling that's leading to the pain. You can also be boosting the immune system. It's really important to have your child's immune system functioning optimally during this time. So here's a few tips to boost your child's immune system. 1. Probiotics. The stomach and digestive tract play a huge role in overall immune function. Probiotics supply good bacteria that help to regulate, support, and protect your immune system. Next, vitamin D. At minimum, your child should be receiving 1,000 international units of vitamin D for every 25 pounds of their body weight. Next, dietary changes. During a time in which your child is fighting irritation in the ear, monitoring their diet is equally important. Eliminating or reducing sugar intake, because sugar will reduce your child's immune system functioning, exactly the opposite of what you want to happen. You may also want to eliminate dairy and gluten. Both dairy and gluten are considered to be extremely inflammatory and can cause a buildup of mucus, so it's best to avoid them during this time. See, no parent wants to see their child suffer and be in pain, so give these a try and let us know how it works out for you.